Depression is now very common. Well, unless you've been living under a rock, you must have definitely heard about it. I mean, someone who's completely disconnected from what's going on in the world. Maybe that's the only kind of person who hasn't heard of depression. The term is very well known. But if we look closer, we'll find that many people use this medical term, sometimes even the medical diagnosis, absolutely incorrectly. My name is Dr. Mikhail Tyutyushkin. I'm a psychiatrist who's been working in this field for more than 25 years, and I'm the creator and director of the Med Science Project, which has been helping people with mental disorders for more than 15 years as well. So what exactly is depression made of? First, it's a decline in mood. Everyone knows that. Depression means feeling down. Quite clear. But that's not all. Besides feeling off, there are two other signs of depression. The second one is decreased physical activity, meaning a person lies on a couch, does nothing, scrolls through feeds, is completely passive. There's also decreased cognitive function, decreased mental activity. That means worse memory, worse attention, harder to concentrate on tasks, harder to come up with ideas, harder to make decisions, and even more so, harder to follow through on them. So depression is, at minimum, these three components, which then break down into smaller symptoms. And the second point that people often overlook about depression is the duration of these symptoms. I mean, feeling down, decreased physical and mental activity, this can happen to any person because they have a cold, they lost their wallet. Well, simply because of bad weather. But it's all time limited, short term. One day you feel bad, the next day you feel good, or maybe you're sad for 2-3 days, then you're back to normal again, and everything's fine again. This isn't depression, it's just life. We talk about depression as a syndrome or as a diagnosis, a medical condition, when this lowered mood, decreased mental activity, and decreased physical activity continue for more than 1 month and show no tendency toward improvement. If a person has no energy, no motivation, or they feel brain dead and don't get better, even get worse, for 30 days and longer, that's when we're talking the actual depression, at least a depressive syndrome, and possibly a diagnosis. And then, of course, treatment is necessary. How do you recover from this? Well, the obvious move is to see a specialist. And of course, ideally, I'd recommend seeing a psychiatrist first, a doctor who can provide the actual treatment. But usually people do the exact opposite. They first go to a shrink, but they can't prescribe any treatment. Of course, to get an appointment with the doctor, you need insurance, money, you need time. In the US, it can take up to 6 months or even longer to get help from a psychiatrist.
I waited too long.
What you gotta do in the meantime, just sit around and wait. Well, that's not very wise. Of course, only a doctor can prescribe treatment. We can't start treatment before seeing a doctor. The good news is there's a group of substances that don't have a medication status, at least not in the USA, but they can still help with emotional and psychological issues. This large and controversial group is called Nootropics. I must say that the situation with these substances is quite interesting. I say substances because that's how we correctly refer to nootropics in the former Soviet countries. These substances have been used since the 1960s and 70s, well, mainly the 70s because the 60s were just the first trials. And the observation period is quite massive. More than half a century. They were used very actively in many different cases, for neurological diseases, in comprehensive treatment of psycho-emotional disorders, and in therapy for psychosomatic disorders. So the experience with these substances is huge. But at that time, evidence-based medicine didn't exist as a concept. As a standard for evaluating treatment effectiveness, the term evidence-based medicine appeared only after the Soviet Union ceased to exist. As a result, tons of studies conducted during the Soviet time turned out lacking sufficient scientific rigor. So what do we do about it? I mean, we've got access to good supplements. They've been studied and used for a long time in the Soviet Union. Yes, it's not as powerful as antidepressants, not as effective as Alzheimer's treatments, but in some cases it's much cheaper, with far fewer contraindications, and is much easier to take. So, how can we actually deal with depression, decreased cognitive function, decreased mental and physical activity, and low mood before we can see a doctor who will most likely prescribe antidepressants? The answer is we can consider nootropic supplements. Again, in the former Soviet countries, they have a status of medications, but for the US, these are either dietary supplements or sports nutrition products. And of course, they aren't antidepressants. Nootropic supplements don't cure depression. Just to be clear, don't expect that after taking Nootropil, Piracetam, Phenibut, or cerebrolysine, your depression will go away. Of course it won't. But still, some degree of relief can be achieved.
Let's talk about Nootropil. Well, it's basically the grandfather of nootropic supplements.
Nootropil, internationally known as Piracetam, can to some degree improve what we call mental sharpness. But what does mental sharpness even mean? Well, patients who take it describe it as having a clearer head,
Think.
Better focus, easier switching between tasks, greater endurance for intellectual work. This effect can develop right after taking a dose within about an hour and then last 2-3 hours, gradually wearing off. At the same time, one can observe the building of these effects that develops gradually over a month. So, Nootropil or Piracetam is definitely an option. For comprehensive depression treatment, it's optimal when combined with an antidepressant. Again, you need to wrap your head around this, and I'll repeat this again, that it's not a treatment for depression, but it can help reduce one component of depression, decreased mental activity. At the same time, you need to understand that increased mental activity from Nootropil, even though it's modest, still doesn't give it a medication status, at least not in the USA. So this is a supplement with roughly 60% effectiveness, right? About 60% of patients feel its effects, 40% don't. This is several times higher than placebo, so in my opinion it's correct to call this a true supplement, but nevertheless this activating effect does exist. However, with depression it isn't always a good thing. If we're talking depression with suicidal thoughts or tendencies, this increased activity can trigger these thoughts and shift you from thinking about suicide to acting on it. Actually, the same problem exists with antidepressants. Some antidepressants list increased suicide risk as a side effect. So with Nootropil too, you need to keep in mind that this risk potentially exists. So how and can this be offset? Well, if depression clearly combines with anxiety, the person is already shaking, trembling, heart pounding, short of breath, then you probably shouldn't start with Nootropil at all. Because again, with active anxiety present, Nootropil's activation will likely feed right into that anxiety. And when I recommend this supplement to my patients, I tell them to monitor whether anxiety appears or worsens when using it. So what shall we do here? Let's say someone has depressive symptoms and decreased cognitive function and starts taking Nootropil. Their brain seems to work better, okay, good. But at the same time, anxiety increases or appears. Surprisingly, we can address this with other nootropic supplements too. We must admit that nootropics have quite different types of effects. Well, if we divide them into bigger groups, there are nootropics with activating effects. The classic example is exactly Nootropil or Piracetam. And there are nootropics with the calming effects. These include, in particular, Picamilon. Picamilon is quite a mild supplement and very much depends on the dosage. In standard small doses, the effect is barely noticeable, but it does have a calming effect and can work as a balancing agent for Piracetam. Moreover, in the former Soviet countries, there's a product called Omaron, which is a combination of Nootropil and cinnarizine. It's not actually Picamilon, but the principle is the same, right? Two substances. One is an activating nootropic, the other, cinnarizine, is a vascular protector. And the combination of Piracetam, Nootropil and Picamilon as a calming nootropic can basically balance each other out. You can find more information through the links in this video's description. Another option if we're dealing with increased anxiety from taking Piracetam or Nootropil is Phenibut, a very common and beloved supplement in the former Soviet countries. In fact, this is one of the few supplements that actually has psychoactive effects, but it doesn't freak out patients. Well, freak out in quotes, of course. The truth is, people often fear psychiatric medications, and Phenibut is perhaps the only one that doesn't fall into this scary category. This is truly a unique substance. One of the few, I must say, that affects the GABA system, gamma-aminobutyric acid, which is, to put it very simply, the switch that controls our anxiety levels. And if we expand a bit more, it affects the neurotransmitter that regulates excitation and inhibition processes in the nervous system. So Phenibut is a supplement, a substance that has a significant and quite pronounced anti-anxiety effect. Not as strong as benzodiazepine tranquilizers, of course this isn't Xanax obviously, right? But nevertheless, the anti-anxiety effect is there and quite noticeable. Unlike Xanax, which is the gold standard of anti-anxiety medications, the big advantage of Phenibut is that it can be taken a bit longer.
Whoa!
The standard course is 3 weeks, but if taking it longer, you can't stop it cold turkey. In my practice, I tell my patients that the dosage needs to be reduced gradually. With gradual reduction over 2-3 weeks, it can be taken for 3-4 months. And the anti-anxiety effect is, well, as I said, weaker than benzodiazepines or Xanax, but can still compensate for excessive activation from Nootropil or offset the anxiety that Nootropil might either cause or make worse. If we're talking about fighting asthenia, weakness, sluggishness, exhaustion, fatigue, especially when it's related to some kind of brain damage, not necessarily anything catastrophic, often these are minor changes on MRI, consequences of chronic traumatic brain injuries, chronic poisoning from various chemicals, or simply poor environmental conditions. One tool that can improve a person's condition in these cases is cerebrolysin. We have a separate video about it. If you're interested, check it out.